Okay, a very pleasant good afternoon to all of our viewers and welcome to Let's Talk. We are delighted that you have chosen to be with us this afternoon. And we just want to welcome you. And we have a very important topic to discuss today. We are talking about the COVID vaccine. Should we be concerned about it? We have some special guests with us this afternoon to talk about this important subject. Of course, on Let's Talk, we deal with real issues, we deal with difficult issues, difficult discussions that are sometimes not often addressed in public. But we are delighted to have the individuals today who will supply answers to these difficult questions in this area, this perplexing area of the COVID vaccine. Before we introduce our guests, however, we want to, at this time, have a word of prayer. Shall we bow our heads? Almighty Father and our God, we pray that you will be with us as we share with our friends around the Caribbean and the wider world. We pray that you will direct the proceedings and grant that as we seek to discuss this very involved and complex question about COVID and the vaccine and our attitude towards it and whether we should be afraid or not, we ask that you will guide in the discussion and grant that we will receive the information that will make us better informed. Take full control and have your way in Jesus' name. Amen. Well, friends, this afternoon we have with us two very important individuals who will share their expertise with us. Let me begin by introducing Dr. Monica Osborne Stevens. Dr. Stevens is a native of St. Kitts Nevis. She lives and works in Antigua. She is a family physician with specialties in diabetes. And of course, I should also say that she has played a very important role in the care and treatment of COVID, the infections here in Antigua. She has been instrumental in the early days back in March, April last year. She spearheaded the testing of patients, when it was so fearful back then. Dr. Stevens is also she owns and operates a private clinic, MOS. I suppose she will tell us what that is all about. But we're delighted to have you with us this afternoon, Dr. Stevens. Good afternoon and welcome to Let's Talk.
Good afternoon, Pastor Greene. I'm so happy. I'm so delighted to be here. I'm usually on the other end. I told you that since Let's Talk have begun, I've never missed a Sabbath. It has been exciting. So I'm really blessed and humbled to be here. Good afternoon to my fellow panelists, Dr. Archer, and to the rest of our listening audience. Hi. I'm looking forward to a wonderful discussion this afternoon.
And next we have with us a gentleman that I met some months ago. Delighted to have Dr. Len Archer with us this afternoon. Dr. Len Archer he holds the title of Professor Emeritus at Advent Health University, where he served as the Vice President for Academic Administration and Academic Dean for undergraduate programs at Advent Health University for 10 years. Dr. Archer is a native of Trinidad and Tobago and received his undergraduate degree in botany and applied botany at the University of the West Indies in St. Augustine, Trinidad. He then completed a MS in biology at Andrews University and a PhD in microbiology at Indiana State University. He joined the faculty of Advent Health University in 1993 and served as an academic department chair from 2000 to 2011. He has published in the area of microbiology and presented at national meetings in student retention and student advisement at the American Association of Colleges, Registrars, and Academic Officers, where he served on national committees. Dr. Archer has been a nominee for several teaching awards and a recipient of the Zapara Excellence in Teaching Award. In 2020, he was the recipient of the Advent Health University Distinguished Service Award. He's an active member of the Forest Lake Seventh Adventist Church there in Florida, where he serves on the board and also on the administrative committee. Dr. Archer, good afternoon. Delighted to have you on Let's Talk.
Thank you very much. It's my pleasure. It's a delight to meet you, and the coincidence of having a program like this and the invitation, I thank you. Also, nice to meet Dr. Osborne, who is I've met for the first time, but I'm sure she has a lot of important and interesting knowledge to share with us as well. Also, greetings to the community who are listening this evening. I hope the information we can provide will be helpful and useful as we travel this earthly pathway.
You're from Tobago. I know your brother well. Your brother taught me, in fact, when I went to Caribbean Union College. Back then it was Caribbean Union College. It's now University of Southern Caribbean. I was in his intermediate accounting class. I did intermediate accounting 1 and 2 with him. So I feel as though I'm talking to somebody very familiar.
That's Junior Archer, yes.
That's right. That's right.
Yes.
That's
right. We've had several archers teach at Caribbean Union College, so I had to wait until you say what the subject was before I could figure out which one of my brothers it was.
Okay, I get you. Yes. Now just Dr. Stevens, you indicated that, or I indicated rather, that you own a private clinic, and it's a must. Before I get into the discussion, just curious, what kind of services do you offer?
Okay, so yes, I am the founder and owner of Moss Medical Services, located in Vernon's Development. As you said earlier, when you were introducing me, I'm a family medicine physician and I specialize in diabetes. So I offer a wide range of services: physical examinations, pap smears, molecular scoliosis. I do just about everything except surgery. Here at my practice, I can give you IV fluids, oxygen, sutures, a wide variety of things I can do here at my private practice. I started a year ago. Of course, with the onset of the pandemic, we had some challenges, but thank God, we're still up and running and God has been good. So I'm grateful.
Okay, wonderful. And Dr. Archer, you are at Advent Health. I believe Advent Health was once referred to as Florida Adventist Hospital. A little bit about Florida Adventist Hospital. As I should say, I still say Florida Adventist Hospital, but Advent Health. A little bit about Advent Health.
Well, as most people know, this institution, what is now Advent Health, started back in 1908, I think it was, as Florida, as a sanitarium. That was the name that was used for most of our institutions then. And in recent years, after that became Florida Hospital, and then now Advent Health. The system is a large system. Before the rebranding about 2.5 years ago, everyone knew Florida Hospital, which is really a large group of hospitals that are part of the Advent Health system. The Advent Health system used to be, many years ago, what was called the Adventist Health Midwest. I think it's what it was called. But the current Advent Health system includes over 34 hospitals, most of which are in Florida, but there are also a group of hospitals in Colorado, in Kansas, in Chicago area, and also one in Minnesota. There are also a few scattered in other states, Georgia, North Carolina, but all the hospitals together are under the Advent Health system. The reason for the rebrand to Advent Health, and I just want to say that because many people still know Florida Hospital and don't think of Advent Health as being the same institution or being a part of the same Adventist institution. The system thought that there were quite a number of hospitals all around the country, and as they grew into a larger and larger system, most of the institutions didn't have an awareness of their connectedness. And so they decided to do a rebrand. So if you're in Kansas, you're Advent Health something. If you're in Orlando, it's Advent Health Orlando. There's Advent Health Celebration, which is near the Celebration community. There's Advent Health Altamont. There's Advent Health DeLand. So every hospital around the system carries the name Advent Health. Not only that, they also operate about 40-something healthcare clinics, and those had various names, and they're all now Advent Health. So all the nursing homes, the clinics, the hospitals, everything goes under the name of Advent Health. So that gives a sense of understanding wherever you are, that you belong to the same Advent Health community. And also the same kind of a service is expected across the entire community. So if that gives you some help. Oh, by the way, Advent Health University, we were once Florida Hospital College of Health Sciences, changed the name a few years ago, and now we are Advent Health University, which identifies us with the same system that the hospitals have.
Well, thank you very much for that update. Very, very insightful. We want to begin this conversation on the COVID vaccine. Let me first ask the both of you, before we go to the vaccine, there's so much excitement about this vaccine and whether it's going to kill us, whether it's going to, well, we will get into that. But can you just update us on the current situation regarding COVID? Is it still spreading rapidly as it was last year? It has been around for a while. Dr. Stevens, let's begin with you. Give us a Caribbean perspective. How is COVID in the Caribbean, in Antigua and in the Caribbean?
Well, Dr. Greene, we're not looking good. We're not looking good at all. It is rapidly increasing all over the globe, and the Caribbean is no exception. I have some recent statistics here.
Did you say decreasing or increasing?
It is increasing. It is increasing. For Antigua right now, we have 195 confirmed cases and 27 active cases. We have had 6 deaths, 2 locally and 4 that was imported. And if we were to go and look at the Caribbean, that has a population of 45 million or 45.29 million, so far, well, currently we have 199,158 cases, with the death toll at 3,948. Our Caribbean is small, and to have a death of 3,948 due to a pandemic, that is not a light thing. If we were to go globally, we can have the recent stats here just for just like a moment ago. Currently, we have globally 99,689. And deaths, 2,122,975. Pastor Greene, those are astounding numbers. We need to do something. I can tell you, Pastor Greene, when the pandemic started and we had our cases, I was definitely on the front line, and I considered myself to be on the front of the front line. And when the vaccine, there were talks about the vaccine, I said, oh no, I'm going to be at the back of the back line for this one. And I recognized that as a medical practitioner, I have to get the word out, and I have to now educate people. So I started doing a lot of research. And Pastor, now I'm telling you, give me the vaccine. I want the vaccine. I have done a lot of research, and I know, apart from God just creating a whole miracle, that is our only hope right now. And so I'm looking forward to getting into some more about that.
Okay, sure. Dr. Archer, how are things up in Florida?
Yes, well, I'm ashamed to say that the United States, which boasts of its finances and boasts of its scientific technologies and so on, at the bottom end of this entire experience. We currently have, and I just, like Dr. Stevens, I just pulled up the data here, the current data for COVID. We have over 25 million cases in the United States, which suggests that we are more than a quarter of the total cases in the world. When our population is about a fifth of the world population, less than a fifth of the world population. Among deaths, the United States currently has 414,000, as reported last night, 414,000 deaths, which puts us above 25% of the total deaths. And that's staggering. When you think of the numbers, 414,000 is far more deaths than the United States have experienced in all of its wars put together, with the exception of the last major pandemic that we've had in 1917, the flu pandemic, which killed several million people. This has been the largest number of deaths. And the numbers are increasing fairly rapidly because there are somewhere around 20 states where the rate of increase is greater. I should say there's a more rapid increase in cases and deaths. So the outlook doesn't look good. And like Dr. Stevens suggested, the vaccine is probably the best hope at this point in time. Without that, and hopefully it's long lasting. We'll get into some more conversation about that later on. But right now, that's the best hope we have.
So it does sound as though we are really at a worse place than we were anytime last year. That is frightening.
Yes,
it is. But let's get into the vaccine. The subject of vaccine has been wow, a hot one. You know, there's so many concerns. But before I go there, why is COVID such a big thing? How different is it from other respiratory conditions? You know, we have had SARS, we have had all kinds of flu, the seasonal flu, that kind of thing. Now, you already mentioned that we have so many deaths, but why is this killing so many people? Dr. Stevens,
Dr. Stevens,
well,
go ahead, Dr. Stevens.
First of all, I want to say this is the SARS-CoV-2 is a part of a family called the coronaviruses, right? And we have seen the coronavirus have been around for a long time. That is the major cause, the main cause of our flus or common colds. But then we had SARS, and then we had MERS. We had SARS, when was it? 2002, and we had MERS in 2012. And now we have SARS-CoV-2. Pastor, I dare say, this is the black sheep of the family. And that's why it is so important that we try our endeavor best to adhere to the protocols. And now that we have the vaccine, look at the scientific data and make not just an individual decision, but make a decision that will benefit the world all over. And so when we look at the SARS-CoV-2, we realize that it spreads more rapidly, it is more contagious, and it's causing a lot of lasting diseases because of the inflammatory processes that it tends to cause. And so, Pastor, those are just some of the ways that it's different from its other family members. And so this is why we cannot take it. We cannot. We just can't.
Dr. Archer, one of the things that the news has been reporting recently is that there are a number of variations, or what we call mutations. First, let me ask you if you can explain what we mean by mutations, just for the benefit of those who are listening now and who may not quite understand that, because we have heard of this strain in South Africa, this one in England. Now we're hearing in Brazil, in Japan, and other places, and they're saying that these mutations are making it so difficult. So a word on that, Dr. Archer.
Well, the word mutation simply means change. It means a genetic change in the organism. And mutations are some things that occur in viruses in all organisms all the time. It goes on all the time. The ones we are much more familiar with are the influenza mutations or changes that occur. Every year we have influenza. It's perhaps a slightly different variant, which is why we have to have a new vaccine for that particular influenza. So the viruses undergo those changes. The changes occur more rapidly than others, depending on the particular virus. Some viruses have more rapid changes than others. And also, where the mutation occurs will have a significant effect. For example, when you hear the coronaviruses are so-called because when you look at them structurally, they have some spikes around them which look like a crown, a corona crown. That's where the word comes from. So these spikes, these outside projections, protein substances, are what attach to the cell. So if the changes that occur affect these spikes and make them more likely to attach to a cell, then that particular one becomes potentially more infective. Also, the changes that the virus undergoes may cause it to do things that are more deleterious to the cell. So when they attack the cell, they can affect the cell more significantly. So put simply, it's changes in these various viruses that will cause the new strains. The other thing is that the more viruses that are there, the more they replicate, as currently is happening with the large number of people who are infected, the more chances there are for mutations. Because there's more production of viruses, so more mutations may occur. There are perhaps thousands of mutations that don't have any effect. But every now and again, there is one mutation that may have a significant change that causes a more deleterious effect. Now, when that one begins to spread, we begin to have the effect that we see in South Africa, in Brazil, in England. And then the changes sometimes mean that the body is not able to stimulate an immune response as effectively. So those are more likely to spread, and then they become the sort of a master race of that particular group. I hope that makes sense.
Yes, certainly. We have, I suppose, as we look at the vaccine itself, one of the concerns that many persons have. Well, I've heard so many conspiracy theories about this vaccine, and there is so much talk, so much concern about it. I know that COVID-19 is not the first pandemic that we have had. Have we had other kinds of reactions to vaccines like we are now having? Is this a common thing? Is this a new thing? Like there's so many persons saying, well, they're going to. I've heard they want to give Black people this vaccine to kill them off. I've heard that the Bill Gates side of it, that they have an agenda. People are saying all kinds of things. So let's zero in on this vaccine. Why the fear of vaccines?
Well, the fear does come with some history. There has been a history of in the United States, particularly, where experiments or treatments have not been utilized evenly across the population. But Blacks, for example, with the syphilis experiments, the Tuskegee area experiments, significantly impacted Blacks because Blacks were allowed to die, to suffer, when they should not have been. They should have been treated equally. But since that time, the Black population particularly has become a little concerned about anything scientific and whatever doctors wanted to do to them. So there's that. There's also the era of internet and the spread of information, where people are, for whatever the nefarious reasons or their fears, are deliberately spreading rumors and of things that are not necessarily true. The Bill Gates story, that is totally false. There's no connection between Bill Gates and the vaccines. Bill Gates, like thousands of people, may have some financial stock in various companies. That's the way most Americans, especially the rich, spread their money around. So you can probably find in some of these companies like AstraZeneca or Pfizer, a limited amount of money that Bill Gates has put in as stock. So that is kind of a thing is used to suggest, well, Bill Gates, he has an agenda. So there's that. But unfortunately, the spread of the information does not match the true scientific information that's there. And the battle physicians and scientists have today is to try to convince people that what they're doing and saying is true. Unfortunately, like everything else, there are always a group of people, scientists included, who do not do the right thing. And that does cause a deep well of suspicion among some individuals. But in my opinion, having read a lot of the research reports and looked at the material for myself, I have no concerns. Now, two things before I end here. One, there have always been a few bad effects of vaccines. And by the way, not just vaccines. There are people who die because they are allergic to peanut butter. So there are a few people for whom there are always going to be some deleterious effect, no matter what medical intervention is used. So that's one point. Are we scared by those few individuals? Well, some people, those few cases always seem to make it to the top, and that's the sort of a sample that people use for that experience. I will also add, lastly, before I hand it over to you, Dr. Stevens, I am currently a subject of a phase 3 trial of one of the vaccines, and that is one that has not yet been released. It's the Johnson & Johnson Janssen vaccine. I'm currently a phase 2 trial. I went in, I'm in a double-blind study, so I don't know whether I got the vaccine or I got the placebo. But I return every 20 odd days for them to draw blood and do testing and so on to see what the immune levels is. And as a scientist and as a Black scientist, I want to be at the forefront. I want to demonstrate to everyone that the only way we can get a good vaccine is if people are willing to test. That's first thing. If there are no people who will agree to be tested, then we could never be sure of what we're getting. And secondly, that there is a lot of careful, there's a lot of care that's engendered when scientists begin doing experiments. And I trust them. Because I'm a scientist, I want that to be absolutely clear. So I'm going to give my life over to the scientists, hopefully for the betterment of my children and grandchildren.
Interesting. Dr. Stevens, can you go into how vaccines work? I mean, we're talking about vaccines. Some persons are thinking, well, they're putting disease in the body, and so that can be good. So a little bit about the workings of vaccines.
Okay, I want to do this by being very simple and share there are about 4 main ways in which vaccines are created. You have what you call the live attenuated vaccine, and this is when they take the live virus and they weaken it. They weaken it and they put it in your body, and your body mounts a response, an immune response to it, and you have antibodies. Then you have the killed vaccine. Examples of the live vaccines are the measles, mumps, rubella, and the varicella, the chickenpox. Those are the live ones, and we've been getting those since we were babies, right? Then we have the killed version where the scientists take the virus in the lab and they kill it. right? They basically destroy the blueprint, and that is put into the vaccine, and that is introduced into the body. Because it's what you call an antigen, the body sees it and it acts it as well. And this example of this one is the polio vaccine. Then the third way you could have a vaccine being created is when you take just a piece of the virus or bacteria, whatever microbe, and you put that into the vaccine and you introduce it into the body. It's not the entire microbe. And finally, you have some toxins that causes the disease. So it's not the virus or the bacteria itself, but it's the toxins that they release. And these toxins cause the diseases. And so those are the four main ways. With the vaccines that we have now, I'm not sure if I should go into this now, Pastor, but now the vaccines that we have now, especially the Pfizer and the Pfizer BioNTech and the Moderna the mRNA vaccines, and that's where a little piece of the genetic material from the virus is introduced into the body. But this is a new technology that we're talking about, and persons have been really afraid because this is new. But I'm telling you, we think that it's new, but scientists have been working on it for decades. It's just that no vaccine have been produced from it. Very same technology, this biotechnology, has been used to treat cancers as well. So this is not really new. And for me, the more I read and researched, I said, wait, if I used to take vaccines that had barely killed viruses or whole viruses that were killed, and now they just put it in just a little piece of the genome bacteria from the virus, that is even better. But Pastor, what they're doing now, so let me explain a bit what they do. So with the mRNA vaccines, the first two that ever been created, as we said, the Pfizer and the Moderna, what they do, they get the mRNA material, and this is like a message that they take from the coronavirus, and they wrap it in a lipid molecule, so to speak. They call it the lipid nanomolecule, and they put it in the vaccine and they inject it in the body. When it gets inside of the cell, what happens, it unwraps itself, and the message that it was coded for, which is to make protein, and in the case of the coronavirus, it makes the spike proteins, the same proteins that Dr. Asher was talking about, the crown, right? So what it does, it sends a message to the cell and it creates these proteins, and these proteins are displayed on the cell, on the surface of the cell. And the body says, what is this? And the body mounts an immune response to that. And so when you come into contact with the wild or the real coronavirus, your body would have already been in a state of preparedness in order to fight off this disease.
Okay, that's interesting and that's helpful. Just another question on the vaccine, and perhaps Dr. Archer, maybe you can answer this. Dr. Stevens went ahead and answered the question I was going to ask about the mRNA. But I understand that many of the COVID vaccines are using that technology, and some folks may be concerned. But there is another concern that some persons have. They're looking at the speed at which the vaccines are being developed. So I've had several persons say to me, listen, I have no issue with vaccines. It's okay, I can take the vaccines, but I don't know what the side effects are. These things are, in the past, traditionally, we have had vaccines being developed over 5 years, 10 years. Now, this is a matter of months, and these vaccines. So how can I feel comfortable taking it? Dr. Archer, can you respond to that?
I'll respond in two ways. I'll give just a simple analogy that might sound even like a joke, and then I'll answer the question. When I was a child, my dad had a car, the very first car he had. And there's a hill that goes up to the hospital. It's probably just about 500 feet up to the top, but it's fairly steep in some areas. And I remember as a child, on Sabbath afternoon, we would go to the hospital to visit people. And when we got halfway up the hill, everybody had to get out of the car because the car couldn't go any further. And so they'd drive the car up, we would walk up, and of course we would be able to drive down. Today, your car can probably drive up that hill about 50 to 60 miles an hour. It's all about technology. Technology has advanced significantly over the last 50 years. When the first vaccine was produced, and the first vaccine we produced many years ago, polio and smallpox vaccines that were produced very early on in the 1950s, thereabouts. It took many, many years for them to come around to even figuring out how it worked and actually making it and putting it together. When I was in graduate school, when I started my PhD, the federal government announced that they would start what is called the Genome Project. And they estimated that this Genome Project, which was a mapping of the human DNA, would take about 25 years. And they said at the time, the deadline date was sometime around the year 2000 or so. 1995, somewhere around there. Before I left graduate school, within about 5 years, the entire project was done. Why? Because every day, scientists developed better and better technologies, discovered new and newer ways of being able to map DNA, map these chromosomes much more rapidly. And some things that were just theoretical, by the time that I was ready to leave graduate school, I could do it myself in the lab. So the development of vaccines today have a lot to do with three things. One, there was some government intervention. They gave money to some of these companies, not all of them. Interestingly, Pfizer didn't receive any money from the federal government in the United States, but they were the quickest, they were the first to finish. So it helped some, but that wasn't the only reason. Secondly, as Dr. Stevens said a while ago, you have technology that was developed, that was being used for years, but it wasn't used as far as vaccine was concerned, but they knew the technology. So it was already there waiting in a way just to be implemented. So that also caused the rapid development. So technology, government intervention in helping financially in some areas, and also the fact that we've been doing research on these things, we know how, we had never just done it because there was no reason to, so to speak. So those are the primary reasons why this thing occurred so quickly. It isn't that they didn't shortcut anything. Right. The only shortcut, if you want to call it a shortcut, is that in some cases, the government said, okay, we did phase 1 trial, we did phase 2 trials, we did phase 3 trials. Many years ago, we would probably wait and do another trial before we came on stream. But because we had a pandemic on our hands, they said, look, it has been proven safe, 95% presumably safety and cure rate, let's move on with this thing. And so they decided to implement it. So those are the reasons. It has nothing else to do with it being unsafe. But like I said earlier on, like everything else, there are going to be a few people who will have some negative effects. But that is pretty normal. People get reactions against penicillin when they go into the doctor's office. There's some people who are allergic and collapse within minutes after getting it, and they have to be treated. But that's not all of us. That's a few of us, a very small number of us. So let's not be fearful. Let's trust the science, and let's move forward with trying to protect ourselves and protect one another.
Thank you so much. Dr. Stevens, you look like you want to comment.
Yes, Pastor, permit me to say something. I just have a quick analogy as Dr. Archer gave his. Pastor, what we have been trying to build an auditorium for a long time, right? And it has not happened yet. What if something happened on another island and we were asked by that government, hey, we have to prepare a place for these Adventists coming into Antigua. And then Pastor Greene is going to say, wow, let's work on the auditorium. Everybody's going to come together and we may get that auditorium ready in 2 to 3 months, whereas many years have passed and we have not done anything. So as Dr. Archer said, sometimes the situation, in different situations, people come together and things are done quickly, but that doesn't mean that they are not done safely. So the federal government created what you call Operation Warp Speed. And with Operation Warp Speed, what they did, they financed a lot of the pharmaceutical companies who showed promise in creating a vaccine, and they gave them everything. They basically give many of them open checks. So as Dr. Archer said, Pfizer and BioNTech were the only 2 companies who did not take money from the federal government. And so what they did, they even flew army representatives around the world to bring in different material. Whereas had it not been for the pandemic, that would not have happened. You would have waited 6 months to a year before you get certain type of material. So because of the pandemic and the dire situation in which we're in, this is why we had to do things speedily.
Now, I just looked up at my, yes, Dr. Archer.
Yeah, just one other thing I wanted to add to that. As soon as the Chinese discovered that they had a problem, they actually did the DNA. They actually completed the DNA, not the DNA, RNA, the RNA structure, and they gave it free to the world. They gave it to the WOH, and every country had it. So they had a head start. If you were doing a vaccine all by yourself, you'd have to work all of those things out, each company, before they even start making the vaccine. But this was done very, very early. So everybody got a head start in terms of trying to develop this vaccine.
Now, I just looked up at my timepiece and realized that we only have 15 more minutes.
Wow.
I'm stunned by that. And there are some questions that viewers have been asking. So I want to look at 1 or 2 of these questions now. In fact, there seem to be quite a few questions. So let's see what the first question here is. The numbers are creating stress for some. To what extent should we be balancing these statistics with what prophetic writings have predicted in the end times? That's the question. Is this just a matter of prophecy? Is it, when we hear about COVID, there seems to be such a...
Well, let me tackle that a little bit. I'm not a theologian, so I'm not going to go down the theology route. But, in 1918, there was a pandemic that killed several million people. I can't remember the exact number now in the United States. I think it was like 15 million. I don't want to throw a crazy number out there, but there were millions of people who died. And, there were lots of people then who said the same thing. They were looking at this Adventist, the spirit of prophecy, non-Adventist, the prediction of the end of the world. There will be pestilences and so on. So forget about this disease thing. Before that, there's the bubonic plague back in the 1400s. Every several 100 years or so, we do face some major disasters. The important thing is living your life in Christ, but trying to pin each of these incidents on the second coming or some other celestial event, I think is not very useful. That's just my perspective.
Okay, so in other words, we are mindful that as we approach the second coming of Christ, things are going to get worse. But we must not use everything that pops up and say, hey, this is it.
Yes, absolutely.
Okay. Now
because every time we've done that, we've lived another 100 or 200 years before something else shows up. So I'm not saying the world is going to last that time. I'm not predicting at all. All I'm saying, let's focus on what is most important. Living a life for Christ and living a life that enables the health and well-being of those around us.
All right, now here's another question. If a person with low immune system has, I was told, sorry, let me see if I get this. If person with low immune system should Oh, I think they're asking if a person with a low immune system, whether they should take the vaccine. Shouldn't there be a CBC blood test before taking the vaccine? This person wants to know, I gather that, should anybody take the vaccine, or does it have to do with your health or your physical condition? Dr. Stevens.
Well, the only guideline that we had for that has been persons who have known allergies to any sort of chemical or component of the vaccine. Besides that, they are encouraging as many people as possible to have the vaccine, even if you may have a condition whereby you are immunocompromised. If you get the COVID virus, what you call wild COVID virus, what happens is that you're going to have a full-blown case, and it'll take a long time to develop those antibodies. So it will be safer if you get the vaccine, even with a low immunity, so that you could start building up your immune system and you start making antibodies. So if you come in contact with the COVID-19 disease, then you will be able to ward off the seriousness of the infection.
Okay, this other question, somebody's asking, we spoke a little bit about mutation, but somebody's asking if the mutations, what are the implications for the vaccines? Now, Dr. Archer, you had mentioned that the spike protein on the virus, I remember hearing a documentary or some discussion on BBC where they were saying that the concern they had for the South Africa mutation was that it was the spike protein that was mutating, and the vaccines were developed to fight the spike protein. So what are the implications for the vaccine and the effectiveness of the vaccine in that case?
Yes, potentially that can be problematic. I know what doctors and scientists are doing currently is and that is increasing now, they're screening a lot of cases to see where these mutations are and what significant changes have occurred. In many cases, the mutations do not necessarily mean disease is worse, and that's what we're seeing right now. That's just the initial observation. What it suggests in the current cases that we have is that it appears to attach more efficiently to the cell. So if it does attach more efficiently to the cell, it probably would cause more disease, more cases of disease, but not necessarily more severe disease. But that is certainly concerning. Now, the other point is, with respect to the vaccine itself, it does not seem that the changes that have occurred are significant enough to prevent the vaccine from functioning effectively. That may change, but currently that's not what is being observed. The last point, because there are several vaccines that are now available, well, at least 2 right now, 3 the Oxford added to the Pfizer and Moderna, and other countries have developed others. The Chinese have developed one, the Russians have developed one. Not sure if I want to use the Russian one, but because there are several vaccines, the likelihood is that a multi-vaccine approach might be effective in the case of an emergency if we see, there are different things occurring. But so far, it has not shown any significant effect that will cause us to lose faith in the vaccines that are currently in use.
Okay, this question, there are a couple of persons who are asking about whether any of you have already taken the vaccine. But I know you did say earlier, Dr. Stevens, that you're anxious to take it, and Dr. Archer, you said that you're in a trial with one right now. But let me add something to this question, because there is, I don't know if this is just politics or something to be concerned about, because as you indicated just now, there are several countries that are developing vaccine. There's China, there's Russia, there is India, there is one developed in India, and people are concerned that, well, maybe some of these, I did hear several news reports that we're not sure we can trust the vaccine that's coming out of China, and there's a big question mark over the Russian vaccine. Now, in the Caribbean, we do have I think they're still debating in Antigua which vaccine they're going to be using here. So what if we get a vaccine from China or from Russia? Should we be comfortable? Is it just politics that is causing concerns over where the vaccines are being developed?
Okay.
Go ahead. Go ahead.
I have not, well, I can speak for Antigua, even though I have not verified this, but I was told that what the government of Antigua and Barbuda is doing, they are putting together a team of personnel who are responsible for doing the research on the various vaccines, looking at all the clinical trials, looking at the effectiveness, the safety, et cetera, and then they're going to put all the information together and they're going to make recommendations also based on price, what vaccine the government of Antigua and Barbuda should choose. And then the government will have the final say on which vaccine. So based on different meetings that I've been a part of, I don't think that we are in the position to say, okay, if someone hands us a vaccine, we're just going to take it because it's free. They're very concerned about the people of Antigua and Barbuda, the Ministry of Health and the government. And so they have put in place a strategy in how they're going to go about choosing the vaccine for the population.
Let me just add to that. And I know I was the one who talked about the Russian vaccine. My concern about the Russian vaccine is that the Russians approved the vaccine and never released the scientific information of the trial results in the early stages of their production. And that's concerning. So without that available to the general public or to scientists around the world, I am concerned. The Moderna, the Pfizer, the Oxford, AstraZeneca, the Johnson, the one I'm in, just released some information just last week about its effectiveness, some data about the percentage of people who show side effects and so on. I'm happy with those because they are releasing the results and they're showing some sort of a honesty and integrity. I don't know anything about the Chinese vaccine again, so without the data, I am not going to recommend to anyone that they just go ahead and take it. But like Dr. Stevens said, yeah, we want to see the information, and if we put our team of scientists and healthcare officials together and they make a decision based on the data that comes out, sure, let's do it. Absolutely.
Now somebody's asking a question here, and it's interesting because it just jogged my memory about something. Now, I found out, the person says, that when our bodies are in an alkaline state, diseases would not thrive. Is that the case with the virus? So well, let me just ask you to react to that, the question, and then I'll add something. Who is going to take this?
You know, I'm always flabbergasted when I see those kinds of statements. You know, the body maintains itself in a state of homeostasis, meaning that it keeps its pH, the blood pH, is always within a specific range. It maintains that. The stomach is an extremely acid environment, and so the pH in urine within the bladder, for example, is extremely alkaline. But the tissues of the body, which are supplied by the pH of the blood and so on, for the most part, have a very, very stable and narrow pH range. The idea that you can drink a lot of lemon and somehow that makes the entire body acid, or eat something else and that makes the body alkaline, is not an appropriate way of describing how the body is. My counsel to people generally is to live a healthy lifestyle. And we know what that is. As much vegetables and so on as we can, rather than processed foods. Exercise regularly, drink a lot of water. And for most of us, those things will help us maintain good health. The extremes of trying to narrow this or health regimen into some sort of a extremely alkaline thing or some acidic thing, as a scientist, I don't really buy.
All right, Dr. Stevens, you want to add something to that?
Yeah, I was thinking the same thing. The body has the ability to balance itself. And so once we are following the laws of nature with our health, and we know as Adventists, we have a very good health message. So once we are following that, we don't need to go and buy alkaline water and buy this water and that water to create any different environment in our bodies. Just sticking to what we know is right for our bodies will work.
That's what I was going to add to the equation, because from my limited exposure, is that the body is an amazing piece of machinery, and it does regulate up or down as the case may be. If we use, this is just an illustration, temperature, when it's cold, the body does something to increase the body temperature and vice versa. So because of time, I want to ask this last question, and of course we will have a part 2 to this, by the grace of God. Both of you, I'm taking that to mean yes. We haven't covered some of the areas yet. Time went by so quickly, but I think it is important to talk to this one last issue before we end today. The vaccines are meant, I suppose, to work in conjunction with the established protocol. But they're meant to work with the established protocols that are in place.
Yes.
I suspect that when the vaccine comes on the scene, some folks like the mask wearing. Some folks may think, because I have the mask, I don't have to do anything else. Or some persons may think, because I have the vaccine, I don't have to worry about social distancing, I don't have to worry about sanitizing my hand, etc. So I would like to get your take on this one. When I get the vaccine, how should my behavior change? What are the implications, and what warnings or lessons do you want to share so that people can be guided by accordingly?
Okay, so first of all, before we can even think about putting aside the protocols, we have to talk about herd immunity. There's a certain percentage of our population that need to have the vaccine, about 80%. And we are faced with a lot of anti-vaxxers. And so if we receive the vaccine and many persons say, okay, I'm not taking it, I'm not taking it, I'm not taking it, we would not get the majority of our population immunized. And if the population is not immunized, it means that the disease is still going to be rampant in the community. So we would not be able to lay down, put away the protocols. So unless we get a certain percentage immunized, we are going to be with the protocols for a very long time. That's number one. And number two, most of the vaccines require 2 doses. And sometimes, in most cases, after you have the first dose, the body is not ramped up to the effectiveness as yet. So you can't say, okay, I've received my first vaccine, so I could done away with the protocols. Your immune system may not have enough antibodies, and that's why you need a second dose of the vaccine. And others are not doing this, then there's still going to be a lot of disease in the population.
Dr. Archer, my final question to you. I just glanced at the chat on YouTube, and I don't know if this is providence or whatever, but I saw somebody saying there, listen, we have the blood of Jesus, we don't need a vaccine.
Pastor, as long as we live in the sinful world, there are all kinds of things that are likely going to happen. I don't say when I drive down the street that because I'm a Christian, I'm not going to put on my seatbelt. I wear my seatbelt because by the way, I also, one of my hobbies is road biking. I bike, and I bike with a helmet, and I try to ride carefully. But there are occasions when I've been riding with my friends, a group of us, when someone in front of me does something, makes an error, and cause 2 or 3 of us to crash. Nothing I did wrong necessarily. So in life, we try to live as healthily as we can, but we also, because of the sinful world we live in, take as much precaution as we can to protect ourselves. So I would hope that person, the person who wrote that, I'm going to speak directly to that person, to consider, yes, we are grateful for the blood of Jesus, which is a spiritual covering. But in terms of the physical coverings of our life, day by day, we still need to do as much as we can to remain healthy.
Well, I want to thank you both for sharing this afternoon. Very insightful. The time went by so quickly. And we hopefully will have part two very soon. I will tell you next week, we are going to be talking about music and mind your music. Should I be concerned about what music I listen to as a Seventh Adventist Christian? That promises to be, next week is part one. That promises to be a very interesting discussion. So I want to just ask all of our viewers to prepare for that one next week. Music, it's the first of our discussion, and we're going to be talking about, worship music, hymns, praise songs. There's a big debate over what the style should be, and later on we will get into some other aspects. But thanks again to you both for the wealth of information that you have shared with us. I have a better understanding. I believe many of our viewers have a better understanding, and I think I feel a little more comfortable with what is happening. We still do have a very fluid situation, and we do want to ask our viewers to be very careful, practice the protocols, and remember what we said earlier, that the virus is actually spreading faster now than it has ever been. So we need to be careful. Thank you both very much. God bless you. Delighted to have had you.
Thank you for the privilege of joining this group. It's nice to speak to my Caribbean brethren. You notice my Caribbean background, even if I'm
I noticed.
In the cold north. Yeah, it inspires me. I'm anxious to go home.
All right, sure. Take care. God bless.
Dr. Greene. It was a pleasure.